Hi everyone. We're just gonna take a few moments for everyone else to join in as well. Okay. I think we should be good to start now. So, hello everybody. Welcome to today's event on tackling inequalities through proactive support during pregnancy. My name is Giselle, and I'm a behavioral scientist at Nesta's First Start mission. In case you're new to Nesta, we design, test, and scale solutions to society's biggest problems. Our three missions are to help people live healthy lives, create a sustainable future, and to, of course, give every child a fair start in life. In today's event, we will be exploring our collaborative project with Camden Council around providing cash grants to low-income parents-to-be, alongside a personalized introduction to what local family hubs have on offer. We'll discuss why the project was needed, how it was designed, the opportunities and challenges it presents, and of course, how to implement it in other local authorities. Now, before I introduce our speakers, I want to invite our audience to join the conversation in the comment box on the right-hand side of your screen and ask any questions throughout the event. We will answer these during the Q&A session in the end. Closed captions can also be accessed via the LinkedIn live stream as well. So joining us first is Councillor Cameron Arif Adib. Cameron has served as a councillor in the London Borough of Camden since being elected in 2022 and as a cabinet member for finance and cost of living since 2024. Cameron will provide an introduction to the programme. We will then hear from Mary-Alice Doyle. She's a principal researcher at Nesta's First Start mission, who will introduce the Family Hub's pregnancy grant from Nesta's perspective and showcase the work of the wider First Start team at Nesta. Following on, we will hear from Lorraine Richardson. Lorraine is a Family Hub navigator at Camden Council. As a navigator, she provides a warm welcome and introduction to the Camden Family Hubs, supports families to feel confident in navigating the services available to them after the pregnancy. And today she will discuss her background, her role, and sharing some case studies with us from the project. Then finally, we will hear from June Nakagawa. June is the Behavioural Insights Lead in London Borough of Camden. She has over a decade of experience in applying behavioural science to improve outcomes in real-world setting across local governments and international organizations such as OECD and WHO. June will be closing out today's presentation with an overview of the toolkit. So without further ado, I'm now pleased to hand over to those involved in the project and to give an overview of the program, the toolkit, and its impact.
Thanks, Giselle. So as Giselle mentioned, my name is Councillor Cameron Arif Hadib, and I'm the Cabinet Member for Finance and Cost of Living in the London Borough of Camden. And I think my role here is to provide a bit of an overview of why we think the project was needed. And to do that, I'm going to illustrate two ways in which we sort of operate as a council when it comes to delivering public services for our residents. And at the core of our approach is being progressive and being proactive. So we very much pride ourselves on Camden on the progressive side in terms of what we do in terms of our welfare support for our residents. So for instance, we've got one of the most generous council tax support packages in the country. 16,000 households, which is about 14% of households in Camden, don't pay a penny of council tax. That's one of the most generous schemes, not just in London, but across the UK. And we also have our own cost of living fund, which provides discretionary cash payments of £500 up to twice a year to families in need. And that very much we see as a top-up fund to the DWP household support fund. So really our core there is that type of progressive view in which we view public services. And this project, this support, pregnancy grant support, is very much within that frame, because we fundamentally believe at Camden that cash transfers do work. We think that giving families money directly is effective, and because they usually know their needs best. And specifically with this project, what's I think really important is we want to try and shape how government thinks about these things when it comes to things like child benefit. Should it be paid before birth and those types of things? And ultimately, why was this desperately needed in Camden? Because the reality is that our child poverty rates are astonishingly high. So before housing costs, our child poverty rate is around 1 in 5. But after housing costs, it doubles to 2 in 5. So nearly 40% of children in Camden are growing up in poverty after housing costs. And that's clearly an intolerable situation. And we think that projects like these, pilots like these, and then scaling them up could make a material difference to child poverty going forward. And the second word I mentioned at the start of speaking was being proactive. And that very much shapes our view in terms of welfare and the public services that we deliver in Camden. Because at the core of our belief is that the onus is on us to reach our communities and not assume that those most in need will contact us. And that's very much key to this program in terms of the Family Hub's pregnancy pilot, because we're using the data available to us. We're working with the NHS to directly reach those who are eligible and not wait for them to contact us. And I know that June, Mary Alice and Lorraine will talk about elements of that going forward, because ultimately that proactive approach is at our core in terms of our approach to welfare and delivering services, where we really prioritize outreach because we think it's absolutely so important. And why do we think that type of outreach is really important? It's because we know that those most vulnerable don't reach out to us often. So with another hat on, I work as an economist at the Resolution Foundation, and in the past we've published a report on social security in Devolved UK. And in it, there's interviews with around 200 low-income parents. And it's very clear that a lot of those low-income parents aren't even aware of the type of welfare support and support in general that a local authority provides. And that's why that proactive approach is so important. It would be remiss of me not to mention at this stage the key partnerships that we've made in terms of this pilot, and in particular Nesta, who have been absolutely invaluable partners in terms of donating their time to help us design and evaluate this test and learn. So we're really, really grateful for Nesta's support here. To sort of finish and summarize our approach as a local authority and what motivated this project is that, in particularly, local authorities across the country are facing real financial difficulties. And often when those types of difficulties occur, you can get into sort of really specific discussions around what we call salami slicing. So which services are discretionary, which ones are statutory, and look at it like that. But in Camden, what I'm really proud of is we try and set goals and missions and then take our decisions from those. So for instance, we want to eradicate child poverty in Camden. What are the best steps we can take to do so, rather than this sort of salami slicing approach to the services that we offer? And I think that this project is a real perfect example for that. And I'm so proud of that we're doing that. I'll stop there, and I think I'm passing over to Mary Alice.
Great, thank you, Cameron. So let me just tell you a little overview of what the Family Hub's Pregnancy Grant is, and just kind of a very brief summary. We can talk more about details if in the Q&A if anyone has specific questions. And there's also more in the toolkit about how we designed this program and the thinking that went behind it. But let me just give you a few minutes of an overview so you get a sense of what it is before we get into talking about the toolkit. So what is the Family Hub's Pregnancy Grant? It is a grant plus something else. So at the core of it is a £500 cash grant that's given during pregnancy. So it's given after the 20th week of pregnancy, when women will have just had their 20-week scan, and then they'll get an offer from the council. They'll get a letter, an email, and an SMS. So kind of hitting all the channels saying, you're eligible for this money, and here's how you can claim it. So that's the grant. It's a one-off payment, unconditional, so it could be spent on whatever the parent chooses to spend it on. And the second element of this program is a Family Hub's navigator. So you'll hear from Lorraine soon, who will tell you about what that's like as a navigator. But just as an overview of what that is, it's someone friendly from the council who will call pregnant people up after they have received the initial communications about the grant. They'll kind of check that the person has received the money and knows what to do with it, but they'll also give a nice introduction to what services are available from the council. And that's really to help people to access more than just the money, which obviously is, it's nice to receive that much money. It's not going to solve everyone's problems, but we can have kind of more long-lasting impact if we help to get people access to other support as well beyond just that initial financial support. So that's what the program is. It's these two elements. It's the money offer plus the family navigator. And then how does it work? Everything that is kind of visible to the recipients is made possible by data linkage that's happening behind the scenes. So we use the council's data on who's receiving local benefits and who's receiving universal credit. And we match that with the NHS data on pregnancy. So from that 20-week scan, so we can see who is pregnant and already receiving means tested benefits. And policy and practice matches that together for us. And so then we're able to see who is eligible for the grant, and we can reach out to them directly without them having to apply or having to know that it's even available before they receive that offer. So really what sits behind this and what makes it possible, and from my perspective really exciting, is the fact that we're able to automate it at least as much as is possible in this kind of pilot, to make it easy for parents to receive the support without needing to go through an application process. So that's what the program is. And then you might be wondering, okay, there's this grant, there's the navigator, why do you put them both together? And there's kind of a lot of thinking that's gone behind that. As I mentioned, it's, we want to make sure that obviously the grant is nice, but having that continued support is going to be really helpful for families as they're about to have a baby. And there's kind of three ways that we think that putting the two things together will be more than the sum of its parts. There's a whole, research literature on cash plus support and stacked interventions. And we're kind of building on that and trying to use that evidence and generate additional evidence on how putting two supports together can help. So one thing is it's going to hopefully free up mental space for parents. So once you've got the grant, you can, buy what you need for the baby, you can pay off bills, you can pay your overdraft. It's unconditional, so it can be spent on whatever the parent needs. But having that, like a little extra breathing room financially at the time, helps to free up mental space that might mean that parents are better able to engage in other support offers. Things like bump to baby class or other things to get ready for the baby, and just to have like a little bit of a relief from financial pressures. We also hope that it will build a bridge to engagement. As I mentioned before, they get the cash offer and then parents will receive the family navigator's phone call. And hopefully having received the cash, which is called a Family Hubs pregnancy grant, and then hearing about other things that Family Hubs offer, will make it kind of make the link and help families to be more open to engaging in that additional support that will be long lasting after the £500 has been spent, to be able to have continued support. And then another way that we think the two things together might help is that it enables smarter spending. And by that, we mean that parents are able to talk to the navigator, who might be able to offer them access to free services and, secondhand or free baby goods. And that means that the money that you get in the grant can be spent on things in addition to what you could already get for free. So being able to signpost to baby banks and signposting to free antenatal classes means that parents haven't got to spend the money on those things. They can spend it on other things. So that's the thinking behind having the two things stacked together. And just briefly on what we're hoping to achieve with this program. So I could talk all day about the evaluation, but I'll spare you that for now. And just as a summary of what we're hoping will happen. So one is that we hope that parents will visit Family Hubs more than they otherwise would have, because they've received the grant and because they've had the Family Navigator warm contact someone's invited them to come to the Family Hub, and they'll hopefully keep coming back. We're hoping that more parents will sign up to the antenatal education courses, so the Bump to Baby course or the Solo Whole approach are the two ones that Camden offers. Also signing up for wellbeing support, as well as additional kind of other support that's available through the council, so additional health visiting appointments and referrals to Little Village, which is a baby bank. We also hope parents will sign up to, specific benefits that they're eligible for that they might not be aware of, that are specific to, that stage in pregnancy or soon after. So Healthy Start vouchers and the Sure Start maternity grant for first-time parents. And we are also able to signpost parents to additional benefits advice, so getting a check to make sure they're also receiving other benefits that they're eligible for, so they're getting everything that they can financially. And then also support to apply for additional benefits that you can receive after the child is born, and that's child benefit and updating the universal credit claim to make sure that parents have the child on their claim. So that's a kind of whistle-stop tour of what the program is and what we're hoping to achieve. For us at Nesta, it really fits in with our Fairer Start mission of trying to improve outcomes for low-income families, children in low-income families. And you really see from the evidence in academic research, we know that pregnancy is a key period in setting families and babies up for a strong start in life. So being able to get access to these services, as well as the additional money during pregnancy, we think is going to have a important impact on these families who've received it. And I'll hand over to Lorraine to talk more about her perspective as a family navigator.
Thanks, Mary Alice. Hi, everyone. My name's Lorraine, as just mentioned, and I'm one of the Family Hub navigators. I also work in the money advice team within Camden as a grants assessor. My background is in outreach work and early years education. So this role, there are 3 of us in this role. There's myself, Julie and Huda, and we focus on offering proactive, personalised support to expectant parents. And our role also entails checking that they've received the grant, reassuring them that it's genuine and not a scam. And we provide a warm welcome and an introduction to the family hubs. But most importantly, this role, we act as a bridge to what's out there and to help them navigate the family hub services. What's been helpful for us in this role is the toolkit and conversation guide. So for me, anyway, it's proved invaluable in making the calls. It doesn't just act as information that we share with the parents, but it also acts as a prompt for me. It just makes sure that I'm covering everything that's on offer, because there is a lot. What I also like about the guide is I know that all of the navigators, so myself, Julie and Huda, will be singing from the same hymn sheet because of the guide, and that we can pick up work consistently across different families. So if I had made the call but wasn't able to attend the hub, for example, I know that Julie would be able to pick that visit up for me. So what's it been like so far? So the calls have been really successful with a good uptake of our offer. And the tours of the hubs where the parents get to meet the IEWs, which are the information. I'm sorry. So the tours of the hubs where the parents get to meet the IEWs, they get a feel for the space, and they gather information about all the services that are available and what they're able to access, like much needed support. And so I've used this picture of Dorothy seeing Oz for the first time because I feel that it captures the moment of discovery for parents. So they don't often realise the world of the support that's out there. So I do feel like this is a good analogy of what this service does. So it opens up a whole new world of support for people. One mum I spoke to said to me, "This is my first baby and I have no idea what's out there." So it sort of really sums up why this role exists. Like I said, parents just don't know what the family hubs offer, and some assume that it's just the family hubs are just a nursery. So I had a call with a mum to be, and she was on baby number 7. And she thought they were just nurseries. So I was delighted that she came along to the tour, because it opened up services not just to her during pregnancy, but also for her older children. So that was a great visit and a great reason for this service. So with all that in mind, I've collated a couple of examples for you taken from both mine and Julie's casework, and I hope this will just give you an idea of the people we're contacting and the immense benefit the service is of to them. So my first example is Joy. So Joy was born and raised in Camden, and she was studying for her social work degree when she became pregnant with her first baby. Joy disclosed that she had a disability and struggled with hyperemesis, which is a sickness that lasts throughout pregnancy, and she'd been quite ill. So she hadn't really had the headspace to prepare for the baby, and at the same time wasn't able to work due to the sickness, and so the financial impact on her was quite significant. She was aware of the family hubs through her midwife, because that's where she had her midwife visits, but she wasn't aware of the services that were available there. So I invited her to a tour of our local hub, and during the appointment, we discussed some of the things she was interested in and all aspects of her pregnancy, including concerns around the pregnancy itself, birth, and then later feeding the baby. But from our chat, we were able to identify that she was keen on joining a bump to baby group, and I was able to enroll her on that day, which was great. She also wanted to apply for the Sure Start maternity grant, but wasn't aware of how to do it, so I supported her to fill the form out again there and then. She disclosed that she was a single mum, and I was able to refer her to Little Village for support in getting some expensive baby items. But I was also able to offer her a referral to our welfare rights advisor for benefits advice. And so she received support from our WRA, and it increased her income by £400 a month. She was also able to join the antenatal class and made new friends with other mums-to-be as a result. And she was able to buy a pushchair bundle that she couldn't have afforded without the grant. And also she had the referral to Little Village for the other items. And now in her feedback, she said that she feels more confident about becoming a mum. So that's that case. My second case is actually Julie's case. And we thought this was a good example to use. So it's a slightly different scenario. So Sarah received the pregnancy grant because she was pregnant with her 5th child. She was invited to the tour by Julie. And during the appointment, Sarah disclosed that she was experiencing domestic abuse and finding the pregnancy very difficult. And she also disclosed that she was in the UK on a spouse visa, which had not been renewed by her partner, which left her with no immigration status and very limited access to support. So the invitation to the hub meant that Sarah was given the time and space to talk about her situation in confidence, but also to access a range of support. So, for example, we were able to connect Sarah with the Camden Safety Net, which is a specialist domestic abuse service. And we encouraged Sarah to join the Parent Matters, a perinatal wellbeing service, due to her mental health. And additionally, what was good about this grant, because it went directly to Sarah, is that she was able to cash the grant without her husband knowing, which gave us, financial independence in a situation where he controlled all the household finances. We also shared information with her on other financial help she could access, including Healthy Start vouchers. And Sarah is now working with the Welfare Rights Team, a family support worker, and has gained access and support to support services for both her and her children. So they're the 2 examples.
Great. Thank you so much, Lorraine. You've shown so powerfully what it means to be a navigator and the difference it's already making for families. You're a very tough act to follow with those brilliant case studies, but I will try my best. What I want to do now is kind of zoom out a bit. We've captured those lessons along with the wider program design in a toolkit that local authorities and partners can use. And we wanted to build this toolkit because we wanted to work in the open. So hopefully other local authorities and partners can pick up and adapt what's useful, whether that's just the grant or the navigator role or the data sharing process. You definitely don't have to take the whole model. You can just lift the parts that work for you. Ultimately, we want this toolkit to help reduce the risk, really speed up delivery, and get support to families sooner. So you don't have to spend, I think it was about 9 months exactly, on the design part like we did. So what's inside the toolkit? So the toolkit is structured as a step-by-step guide. It starts with a DIY checklist and our design principles. Then it walks through the core elements like the pregnancy grant, the family navigator, and how the data flows work. We've also included FAQs that answer the questions councils always ask first around kind of funding, safeguarding, operations, and they're ready-made templates and materials you can hopefully lift directly into your own context. So you can skim it quickly or do a deep dive if you're kind of ready to start designing something similar in your own boroughs. On the next slide, I want to highlight a few aspects of the toolkit based on what other councils told us they'd be most helpful. The first is communication assets. So we've included the conversation guide that Lorraine mentioned, plus all the letters, emails, and texts that we've used. And these were co-designed with parents, midwives, and we're very lucky to partner with Nesta because that meant we could have 4 behavioral social scientists, including our brilliant colleague, Dia Nielsen, who's another co-author of this toolkit, and then also tested it with 50 plus families when doing our discovery research. So these are very rigorous council communication materials. So hopefully you can adapt the wording and kind of script to your own context. The second is around data access. This is the trickiest part. As everyone I'm sure on this call knows, with health and benefits data sitting in different systems with different rules, and no one has really sat down to design an end-to-end flow that connects these 2 data sets. In Camden, we're very lucky to have Benny Soto, who's our design lead, and another co-author of the toolkit. She was really the brains behind Frankensteining all those moving pieces into a single, safe, kind of legally robust data flow. So the toolkit now kind of lays out this step-by-step. So hopefully other councils don't have to figure it out from scratch. And this was so key to get the data protection clearance and get partners on board because it really anchored everything in the statutory duties and data protection laws that we already use. So it felt less like a risky new experiment and more like an extension of what we already do. The third is really practical service delivery tools. So a step-by-step service map and a budget template to help you plan costs and operations. And finally, some ideas around adaptability. For example, if you can't access maternity service data, could you start thinking about, simple application process for a smaller grant size? And our very brilliant colleagues from Nesta also put in some kind of different evaluation options as well, depending on your capacity and need. On the next slide, so we wanted to share how you can get started. And this is good news for you because you already ticked off the first step just by attending this event. So hopefully you can build on this momentum and start thinking about defining that strategic purpose or mission that, Councillor Cameron shared earlier, that you may share with other services that could really drive this approach. Is it about improving health equity or boosting engagement with services? I really believe having that clear why before the how helps you bring in the right partners with you. And from there, it's about building your partnerships, whether it's in maternity, early years, benefits teams, and crucially, the senior sponsors. We're so lucky to have Councillor Cameron backing us from the start, and as well as senior officers like Abby Knight, who's a public health consultant leading amazing work on child poverty through Raise Camden. Please check them out. and Zoe Tyndall, who heads our Money Advice Camden service. None of this would have been possible without them. I have to mention, Zoe has been so committed that she's expecting her own baby any day now. But I'm really hoping she's not on this webinar listening in from the labor ward. But hi, Zoe, if you are. And the third part is around kind of start on developing data flows early. So with health and benefits data being so sensitive, and each partner knows their own system, but rarely the full kind of end-to-end picture, and to use it for this purpose. That's why mapping and using dummy data to test are really crucial. And we're very lucky to have a very skilled and very patient data lead, Alex Biden, to work closely with policy and practice to build a bespoke matching process for us. As I mentioned earlier, if you don't have access to maternity service data, it's really, I think, important to not just say no to this project. You could think about, using birth registration data as a starting point and maybe doing a post-birth offer, or speaking to your colleagues about, is there a new data sharing agreement in the pipeline that you can kind of join onto? And finally, it's about start shaping your offer by understanding, what does exist, find out what outreach is currently happening during pregnancy and early years, where are the gaps, what budget or funding stream could support this. So for example, DWP's new Crisis and Resilience Fund, which I think starts from next April, could be one of the ways to kind of fund this in your communities. On the next slide, I know I've shared a lot about the process and tools today, but I kind of want to end on something that actually matters the most, and that's the parent making real choices for their baby. And that's why this toolkit really matters. It hopefully helps councils offer support at the right time in the right way. Nesta has just started the evaluation. It's early days, but I just wanted to kind of end on this quote from Joy, the first-time mom that Lorraine talked about earlier. It's just one story, but it shows why this grant can be so powerful. When a parent feels seen and supported, it doesn't just change their finances, but it can open doors to other help and even rebuild trust in local services. And that's what we're starting to see in Camden. So we'd love to hear how this could work in your area, or what you need to make it possible. So I'll open it up to questions.
Thank you, June. And thank you so much, everyone, for the overview of the program. It was really engaging, and we already have a few questions from the audience as well. I will now invite all the panelists back to answer the audience questions on the toolkit and its impact. We also have some pre-submitted questions, so I will try and go through a couple of those first before taking some from the live audience. In the meantime, please add your questions using the comment box on the right-hand side of your screen. Great. So one of the pre-submitted questions, I think, links quite well to one of the case studies you shared, Lorraine. And the question is on how can specialist grassroots organizations working to address violence against women and girls can both contribute to and benefit from the program across different boroughs?
I can start with an answer and hand over to the Camden team for a bit more detail. But I think, so one thing that we did at the beginning of this process was thinking about how we were designing it and mapping out what the journey and support available was for families like currently in Camden before this new service came in. And so I think it's like part of it is just like it's for the local authority and also for the services that are supporting in the area, but just like being aware of what each other is offering and to be able to build that together as opposed to trying to create a new service. But I'll hand over to the Camden team to give a bit more detail about how that's happened in Camden.
Yeah, happy to jump in. I think for grassroots organizations thinking about who really specialize in violence against women and girls, I think there's such natural partners where they could, potentially train, if they have a navigator, someone in that role, really weigh in on the communications so it can feel really safe and speak to that demographic, and also provide referral routes. And I think it's a really great way to think about, how we can kind of tie into more specialist support that is available.
Great. Yeah, thank you so much. Another question was, what are the information sharing requirements needed, and how were they overcame to enable this data sharing to be agreed upon?
Again, I think maybe the Camden team can give a bit more detail of what happened in Camden, but really I think what sits behind it, as I mentioned earlier, is the benefits data and the NHS data on pregnancies. And so it's really just finding a way to be able to bring those two things together. And you'll see in the toolkit, we have a whole section on that kind of data process and some reflections on, because in Camden there are four main hospitals that parents are going to for their pregnancy services. That means getting information from all four hospitals, whereas that might be different in different local authorities that just have one or two. Yeah.
One thing I would also add is that Camden, in terms of data protection in Camden, it starts from like a project from this with like a really high base. So we're really proud. Over a few years ago, we launched what we call our data charter. So we take data protection and how we use data so seriously, and because we have built that type of capacity and that type of legal framework in place, that really helps formulate projects like this going forward. So that's really relevant to all local authorities going forward.
And I think just to build on that, I think the advice I'd give is kind of build on kind of existing agreements. Don't reinvent the wheel. So for us in Camden on this project, we kind of extended on an agreement with CHIS, so Child Health Information Services. That's typically used for health visiting, and then extended them to include the pregnancy scan data. So it's grounded in kind of GDPR and the Equality Act's duties and things like that, and all that's in the toolkit. But I think starting the data protection impact assessments early, bringing in your information governance colleagues in is really key to kind of get this off the ground. So hopefully you can take some lessons that we learned in Camden and kind of think about how you could apply it to your borough.
Great, thank you. I think we're ready to move on to audience questions now. So we have a question from Sarah, who says, I'm interested in the behavioral science you used to design this. Presumably a decision was taken not to make people need to have contact with their family navigator first to access the grant. Did this pay off? And what are the rates of uptake for the family navigator support so far?
Yeah, so that was definitely one of the principles in our design, and we set those out in the toolkit, again, in the design section of the toolkit, about what the principles are that we base this on, and really wanted to make sure it was unconditional. So we talked about, it would have been logistically easier if we could kind of tie it into going into a family hub to be able to receive the cash. We wanted to make sure those two things were not necessarily linked, so you can get one without doing the other. And I think we'll need to wait a bit longer for our evaluation to see if that paid off and see what we find out from our survey and interview and analysis of admin data, which is all going to take a bit longer, unfortunately. But we do see that there's like a relatively high uptake of the call. So having us going to calling parents, and more than half of them are kind of picking up and engaging in that conversation, which we didn't have a good sense of how many would engage, but that seems like around what we expected, or perhaps a bit higher, to have more than half of parents engaging with that and going through the full conversation.
I have to add, having done a lot of outreach work in local authorities, that's very, very high. It's usually around 10 to 20%. So we're really excited about these early results in terms of increasing engagement.
Great, amazing. We have another question on what proportion of the pregnant population are eligible for the universal credit and therefore are being issued this grant?
Great question. We don't have an exact figure yet, but to give a sense of scale, as Councillor Cameron mentioned, we know that 2 in 5 children in Camden live in poverty after housing costs. So we're guessing it's reasonable to sound it could be, up to 40%, but that's still an estimate, and we can't directly link every pregnancy to one's kind of benefit status. But because we don't know that, we've kind of put in some workarounds to make sure we don't miss families who fall outside of our data. So for example, those who are not claiming benefits, even if they're eligible, or maybe they're receiving maternity care in another borough. So we built in this kind of self-referral route, which is a really simple application. So we want to make this offer inclusive as possible, but we know, our data flows aren't perfect. So we've kind of built this kind of application process as well to get to as many families as possible.
Yeah, and also just to add on that, we also have, even for those who then end up not becoming eligible, we have a host of other welfare support packages that we will refer them to, that where there's less sort of strict criteria. I mentioned our cost of living fund earlier, where households can get payments of up to £500 twice a year. So that's really important. And in terms of the eligibility, as June said, it's hard to estimate. But one thing that's particularly the case in Camden, which is one that we have to keep an eye on, and it's probably similar across inner city London, is you've got quite high eligibility potentially for something like this, up around 40%. June mentioned could be the number, but also on the flip side, we're a borough of huge inequality that I think around a third of the children go to independent schools. So you've got this massive sort of polarizations of this, and that's something that we're particularly aware of in Camden going forward, that we want to try and ensure that this isn't just a borough of extremes. And that's why projects like this are important, but that's why also supporting those who aren't eligible for something like this is also important, who are just off the threshold. And that's very much what we do with our other programs.
I would just add to that as well, in terms of like trying to get ballpark numbers for your own local authority. You can go to DWP Stat Explore, and you can look at the universal credit data that's in there, and you can break it down by families who have children of different age groups. So you can actually see how many families within each local authority are receiving universal credit and have a baby who's 0 years old, 1 year old, 2 years old, and that can give you a good sense of what the number was for last year, and then you can use that as a pretty good proxy for what it will be in the coming year. And if there are questions about that and how to do that, feel free to email me. I'm happy to show you.
Thank you so much. Another question is saying that we obviously talked about how the design phase took 9 months, but what is actually the overall timeline for this trial?
It's long because it takes a long time to make a baby. So in terms of the design of the intervention, that was about 9 months from when we started thinking about it and thinking, is this even possible, to actually launching it, which was really quick, and it was very busy, but amazing that we launch a pilot within that time. And then the pilot itself is lasting for a year, and then we're doing an evaluation that will, again, because it takes time for babies to grow and to see outcomes, we're going to look at outcomes through to when the baby is 1 year old. So we hope to have results from the evaluation in 2028, which was like a long time away, but we're kind of learning it as we go as well.
Great. We have a great question from Malu, who's asking, how do you ensure legitimacy and data privacy? How people won't be annoyed or suspicious by this approach of proactively contacting them before applying?
Yeah, that's a really great question that we've thought long and hard about. As you can imagine, getting a letter from your council saying, you're pregnant, here's 500 pounds is a welcome surprise, but it's easy to think, could this be a scam? So we definitely tested, the wording with parents I spoke about and midwives. We also made sure to have multiple points of contact. So sending a letter and an email first in case, they don't get the letter or email, texting them, and then also having a dedicated web page to show that's legitimate, and working with midwives, GPs, and other partners to kind of promote the grant as well. And it's also so nice to have someone like Lorraine, who's just so lovely and can call you up and kind of reassure you that this is a real thing and she's a real person and she can give you a lovely in-person tour. So hopefully as we kind of reach out to more parents, it'll be less of an issue, but something that we definitely kind of thought about and kind of reassured people. And everything is all, you can opt out. So if you don't want the cash grant, if you don't want to be involved in the evaluation, it's all optional. So we definitely want kind of make sure that we make that clear in all our communications as well.
The another question is asking if you could expand on long-term sustainability and where the funding may come from in the future delivery.
As I probably should take that one, but in terms of long-term stability, ultimately these things do require political will going forward, and I hope that our council administration has certainly showed this at this time. Obviously, things may change, and we've got elections coming up next year, and these things are the way in local politics. But what's definitely really important is that we, by piloting this, we want to show the evidence base and make it clear this is really effective, and try and make that point to government around when child benefit is paid. But also in terms of like conversations with other councils, I think the biggest thing that you hear is not A, just how brilliant it is, but B, can you expand the eligibility criteria and what's the long-term sustainability for it? So I think there's clearly huge political will to try and keep this going in the long term, and that's really welcome, and certainly something we'll continue.
The next question we discussed a little bit, but it's essentially about how the cash transfer offer is unconditional, and does this mean that parent does not have to engage with a family navigator in order to get the grant? And if so, were there parents who chose not to engage with the combined package of support and navigator? And in short, I think yes, but if the panel would like to expand on it.
Yes, so they're kind of tied together nominally, but they're not conditional on receiving one for the other. So I think pretty much everyone takes the cash, which is what you might expect. Why not? And then in terms of the navigator offer, so we know that there are obviously parents who know about family hubs already. Most children in Camden do go to family hubs at some point in their early years. So of course there are a lot of people who are having their second, third, fourth, whatever baby who already know a lot about family hubs and don't need to have that tour and all of that support offered to them. And so they might just talk to the navigator and then say, yeah, that's great, thank you for calling, but I don't need a tour of the family hub. And there are others who, as Lorraine said, are onto subsequent babies and they haven't actually engaged with family hubs before and really appreciate having that offer. So it is, you know, generally first-time parents are the ones who are least likely to know about it and more likely to want to engage with that full package. But it's useful, I think, for everyone and to offer it to everyone.
Great, thanks. So another question is asking what informed the final outcome of the project, i.e. the grant? So how does that solve other key issues like moms not really accessing existing services?
Yeah, so we know that there are obviously a lot of issues that can't be solved with the grant. £500 is a lot of money, but as I said earlier, it's not, you know, it's not going to even pay your rent or a lot of, you know, bills in over the period of pregnancy. So we see it as like, you know, a welcome additional financial gain, but it's not going to be lifting families out of poverty, obviously. So yeah, I mean, we can't solve every problem with this program, but we think pairing the money with this offer of continued support and knowing where making sure parents know where they can go to get continued support after the baby is born and further on in their pregnancy, we think gives it the best chance of having a prolonged impact that's beyond just kind of that couple of months of financial relief.
Yeah, and I think just to build on that, to be fully transparent, we had kind of big ideas around, could we, you know, match it to birth outcomes and other kind of maternal health outcomes. When we looked at the reality of our data, that would take so long to kind of access and get. So then we kind of scratched our heads a bit and kind of looked at, you know, what can we track? What outcomes can we measure? And that's where we kind of turned to kind of the family hub engagement. And the Nesta team have been really thoughtful, create a really thorough theory of change. That's also in the toolkit as well, to see how these kind of outcomes could link to kind of greater long-term outcomes. But for us, it's really, you know, what can we measure? And then what's the impact? I think that's where it's been really great to partner with Nesta, not only looking at, you know, how does this change the the uptake and engagement, so that administrative data, but also that qualitative work. So those case studies and interviews that kind of Lorraine shared of what is the kind of actual impact this has on parents.
Thank you both. We have a couple more questions. So Liam asks, are there any measures tracking impact? So for instance, uptake, feedback from recipients, etc. And is there any comparison data for women not accessing this service?
Yeah, so this is getting to the evaluation. And as I said, I could talk for a long time about this. I'll try and be brief. But if you want to talk more about it, then Liam, do get in touch. We're happy to talk more about what we're doing in the evaluation. So in terms of what we're tracking, the main outcome that we're tracking as our primary thing that we want to achieve is to get more families into family hubs. And that's what we're able to see in the admin data. So we're going to look at how many times parents and the child, once they're born, visit the family hub within the first 12 months of the child's life. And so that's kind of one thing that we're looking at. We're also, as we talked about, doing interviews to kind of hear more from parents about how they've experienced it and the impact on them, and other contextual factors that affect how much impact the program might have. We also are doing a survey to ask parents, some measures of their kind of well-being and stress levels and the impact that they think the cash has had. And again, that's not perfect, but it's kind of helping us to get a bit more data on what's happening. And yeah, so we've got our surveys, our interviews, and the admin data. And through that, we're hoping that we can learn about the impact. And one thing to mention that I didn't mention earlier in talking about the program overall, but for our evaluation, we are actually randomizing the Navigator offer. So that means that about half of the families who get the cash grant will also get the Navigator offer, and the other half will receive the letter about the cash grant that also signposts them to the support that they would hear about from the Navigator, but they don't have that proactive outreach. So what we're really trying to test is, does that proactive outreach have more of an impact than just having that signposting and this information written down? And that was kind of driven by wanting to be able to test this rigorously, but also knowing that this is a new service. We don't actually know if it works, and we want to test this. And it takes time and resources for Lorraine and the rest of the team to do these calls and to do the tours. And we want to make sure first that we're not overloading them as we're just starting up, but also that we kind of know what we can be confident if we continue this, that there is an effect, or if there's not, then we can change things.
Thanks, Mary-Alice. And hopefully this answered your question on main outcomes as well, Rob. And in terms of when we anticipate reporting on these, it would be 2028, as we discussed, but there will be some interim reports in the meantime as well. So finally, Halton Family Hubs have recently introduced the Navigator role, and they're keen to understand whether Camden is evaluating the effectiveness of the Family Hub Navigator role.
Yeah, so I think we just covered this in terms of the evaluation of this program. As we're randomizing the offer of the Family Navigator, then we'll be able to look at whether a main outcome we're looking at is whether the parents who received the offer from a Family Navigator are more likely or go to family hubs more than those who didn't. So that's one thing that we're able to do through the evaluation. We're also as we talked about, doing interviews as well, and the case studies that you've seen. It's been really lovely just starting the interviews and hearing from families about what that offer has meant for them. So we'll report on that as we learn more.
Great, thank you. There's a pre-submitted question that I would be really keen to ask and possibly end on, and that is, what advice would you give to others looking to start a similar initiative? So what's the minimum viable partnership or infrastructure that they would need to do something similar, potentially in other boroughs?
I'm happy to start. I think from our experience in Camden, the MVP version would be really senior leadership willing to back something new. I think local partners who know how to find your cohort, these eligible parents, and you definitely need a Lorraine, someone who's very friendly, knowledgeable, frontline staff who can connect with families to the wider support. In terms of infrastructure, it's not going to be perfect. You don't need a complex system, but if you've got like the three basics of a way to find people, a way to pay them and connect them, and a way to kind of learn from them, that evaluation is key. I think everything else can kind of grow later. So don't wait for the perfect model. I think it's worth kind of trying and taking these steps now.
I think what I would add to that is, as the kind of research lead on the team, try and do things that are, different, and see what we can learn from them. And what we would love to see is other local authorities doing similar interventions, or if you're already doing something similar, then please get in touch with us so we can kind of bring together what we know and what we're learning from this and similar programs as we go. It's something that we have a good sense that giving families more money is going to help them. That's not that controversial. We have a pretty good sense that, from the families that have been through the program already, that they've been helped by the navigator support, but there's like very little kind of rigorous evidence that brings together these two things. So bringing together the offer of financial support and some other kind of support, and showing, is bringing the two things together more than some of its parts? And if so, are there different ways that we could design the program so that it's, the lowest cost for the highest impact? And so if you're doing something similar or thinking about it, then please do get in touch and we can see what we can learn from each other.
Yeah, and just on that, one thing I would add is that really, particularly for local authorities, really reaching out to partners. I think, and I know in Camden we're in a unique situation with where we're situated, and we're lucky we have many great organisations on our doorstep, but we also recognise the value so much of working with these partners for programmes like this. We have a similar type of program where we're working with the New Economics Foundation on disability employment support, which has been really, really fantastic as well. And being proactive as a local authority to work with these partners, and as I said earlier, Nesta have been invaluable on this pilot, is so important.
Hey. Thank you. So if there are no more comments or questions, I would like to say thank you to everyone joining us today. And I'd also like to say a huge thank you to Cameron, Mary-Alice, Lorraine, and June for sharing their experiences, reflections, and their amazing work on this program. Now that we have reached the end of this event, I would be really grateful if the people joining us in the audience could please fill in a short survey that it would be linked in the chat. As a thank you for filling out the survey, you will be entered into a prize draw and you will get to win a £50 bookshop.org voucher, which is pretty good. If you haven't already, please sign up to our newsletter and we will let you know about any other events that are coming up across our missions. The link of the newsletter will be posted in the comment section on YouTube and LinkedIn as well. So thank you so much for everyone joining us today, and we hope you have a great rest of your day.